and welcome again to InjuryGuru.com. I'm Carla Schimmelpfennig, registered physical therapist, and this is the second video and second exercise in the knee replacement exercise program number 2. And what I'm going to show you in this video are actually 2 different stretches you can do fairly quickly and pretty easily. That one stretch is to work on bending of that knee, and the other stretch is to work on the straightening of that knee, or getting that knee as straight as you can. When it comes to that bending and that straightening, you want to make sure that you're getting as much motion as you can, especially on the straightening. You want that knee to get as straight as you can get it in order for you to walk normally and just do all the things that you do on a daily basis a little bit easier with less pain and just more normally. The amount of bend that you're going to get back in that knee, you're not going to get, most likely, most of you will not get back the amount of bend in the new knee that you have in your normal knee or your other knee. And to find out exactly, how much bend your doctor expects, he is the best one to ask that question too. So make sure you ask your doctor how much bend that you should get in that knee, and then you'll know what you need to work toward and how long, how much you need to do this particular stretch. So let me show you the 2 stretches that I have for this video. Alright, I'm going to give you a view of just my knee and my bench here so that you just have a nice close-up view of what I want for this stretch. You can use a bench or a stool, anything around the house that you have that might resemble something like this. A lot of times my patients will use an ottoman or a coffee table as long as it's nice and heavy and still. And then another great thing to use is just stand at the bottom of a staircase and use the first, second, or third step. It just depends on how much bend you have and how much bend you're working on. So for this one, you just want to put your foot up on the edge of that ottoman, a step, or a bench or stool, and you're just going to lean your body into that to work on the bending of that knee. Now, when you do this one, you're going to feel some tightness, maybe even discomfort across the front of that knee. And that is fairly normal. That's actually very normal. You just want to make sure it's tolerable and it's not causing you any sharp pain or stretch that you just can't tolerate. When you do this, I want you to hold it anywhere from 10 to 30 seconds, and I want you to do 5 to 6 repetitions of this particular stretch. And the longer you can hold it, the longer I want you to hold it. So if you can hold that up to 30 seconds, then go ahead and hold it up to 30 seconds. A lot of times when my patients first start this exercise or this stretch, they aren't able to hold it as long. So maybe 10 seconds, 15, even 20 seconds is all they can tolerate. But the more you do it, the more you'll be able to tolerate that. All right, so for the next one, actually, you're just going to put your heel on the surface, whatever you're using, if it's that ottoman or the stairs or step. And what you're going to do, lean your body forward till you feel a nice good stretch in the back of that knee and the back of the thigh. Then I want you to take both your hands and put that right above the knee on the top of your thigh and just give a downward force like that as you stretch forward. Now, the amount of that downward force, it's all dependent on your tolerance, your pain, and the stretch that you can tolerate. So again, pushing down toward the floor while leaning forward. This one too, you're going to hold anywhere from 10 to 30 seconds. Once you get to that magic number for you, whether it's 10 seconds or 30 seconds, then you want to just come up off of that stretch, give yourself a few second rest, and go right back into that lean forward and give that downward force toward the ground as you hold that stretch. For both of these stretches, if you have a problem with balance, you are a little unsteady, make sure you do it next to a wall. If you are doing this at a staircase and you have a rail that you can hold on to, that's great. Otherwise, do this by your kitchen counter or kitchen table. Remember, getting that bend back and that knee as straight as you can get it are really important. So make sure you include these 2 stretches if you are lacking in either of those directions. Most likely, most of you will be lacking some of the bend and some of the straightening. So again, make sure you include both of those in this program, and just make sure you're not overdoing it. Add some ice and elevation still if you need to. And just listen to your body. You're doing well. Watch the rest of the videos in this program and just get going.